For schools with established labs on campus before the pandemic, there was some existing capacity for the large-scale testing they needed. Some schools devoted resources to building new or additional labs on campus. Others chose to send test samples to commercial labs operated through companies like Quest Diagnostics, LabCorp, and the Broad Institute. Student health centers send samples once or twice per day and the results are transmitted back to the school, often electronically. Barkin says many schools have pre-existing relationships with commercial labs for testing other kinds of health samples, but the volume of tests was drastically increased. What was different was the volume of the laboratory work, Burkin says. If you're testing students who are symptomatic, students who report that they've had a positive contact, and you're also doing surveillance testing, that ramps up the volume considerably from what you were traditionally sending a laboratory pre-pandemic. In a survey of 500 colleges and universities from August, only 27% of schools planned to test students upon returning to campus and 20% said they would test their community regularly to some extent, according to the preprint study. Additionally, those schools with larger endowments and higher academic rankings were more likely to plan to test, compared with lower-ranked and lesser-resourced schools. Barkin says that many schools which did not use surveillance testing measures in the fall have adopted them for the spring term.